plantar fascia is the thick connective tissue layer on the sole of the foot. It kind of runs from the heel all the way down to the pad of the foot. And the problem is that when patients do vigorous exercise activities, sometimes it's because they just have to do a lot of walking. We have a lot of mail carriers, a lot of policemen, a lot of people that are on their feet that are moving around, people that work in warehouses, athletes. They can get micro trauma. So basically what that means is there's little tiny tears within the plantar fascia. And this little micro trauma causes inflammation. That inflammation causes swelling and weakening of the plantar fascia. So if you don't completely isolate the plantar fascia, then it actually you get this repetitive microtrauma. So it continually tears, and patients go through this cycle of this recurrent pain. Sometimes it's just constant, sometimes it kind of comes and goes. And so what we do, as opposed to going in and doing steroid injections, which a lot of patients have, or putting them in special orthotics, we'll go in through the artery and we put a little tiny microcatheter. It's called a microcatheter because it's about a millimeter or two in size, and we fish it all the way down into the little arteries going to the plantar fascia. And we inject this medicine, and the medicine is mixed with the contrast material to form these tiny little micro crystals. So it's a little bit, about 1/10 of a millimeter in size. So little tiny things, and they go right out to the little capillaries at the end, and they block the blood supply to that abnormal area. But the medicine is also an anti-inflammatory, so it sits there, and as those little crystals dissolve over 2 or 3 days, they slowly leak that anti-inflammatory medicine out into the plantar fascia. And what that does is it decreases the inflammation, it decreases those abnormal vessels, and it allows the plantar fascia to heal. And so patients, will feel pain relief pretty quickly within the first couple weeks, but it improves drastically over the next 3 to 6 months.